afternoon. I am Dr. Annapurna, Senior Consultant Gynaec Oncologist from Sri Shankara Cancer Hospital, Bangalore. Today I am going to talk about endometrial cancer. Endometrial cancer means the cancer that occurs in the womb or the uterus of a woman. So when does this occur? This generally occurs after menopause. Rarely it can come earlier also, but that is very less percentage. Majority of the times it comes beyond menopause. That means once woman has stopped her periods. And how do you know that you've got endometrial cancer? By getting bleeding or any discharge from the uterus or vagina after periods have stopped. So this is a common symptom that occurs. So how do we deal these cancers? First, we have to diagnose where is it come from. That is from the uterus. We take an endometrial biopsy, what we call. That means this is a very small procedure which all the doctors do in their OPD, and we just put a very small thin plastic tube inside the uterus and suck the contents from the uterus, which will contain the cells. These cells, when we examine them under the slide, under a microscope, then they will look abnormal, and that gives us information that yes, there is some problem in the uterus. Some information we also get from the ultrasound reports. Many women come to us with an ultrasound report telling that lining of the uterus is thick. So a lining of the uterus basically is dependent on the hormones. We do not expect a thick lining when the woman is in menopause. So normally the women of menopause will have a very thin lining of 5 mm or less, or sometimes rarely they also may have 10 mm but without having any symptoms. So if you do not have any symptoms and the lining on the of the uterus on ultrasound is less than 5 mm, majority of the times nothing happens and it's a normal uterus, everything is normal and you don't have to be worried about endometrial cancer. But if the lining is more than 1 centimeter, then if you have any bleeding or discharge, it may point out to a cancer in the uterus or your womb. So after diagnosis, after you show to a doctor and get it diagnosed as endometrial cancer, the first and foremost thing is that we have to get a surgery done. Majority of the times these tumors present early because they have bleeding or they have discharge from the uterus, and patient will come to us telling the history that yes, I have had some bleeding, I have had some discharge from vagina, which is not normal in that period of time. So these are tumors which come in the first stage of the time or early stage in majority of the times, but rarely they may also come in late stages, or if you have ignored these symptoms of bleeding after menopause, then these women sometimes come with late symptoms like tummy bloating or fluid in the tummy and things like that. That time it becomes advanced endometrial cancer. So the treatment for early endometrial cancer is surgery, and robotic surgery is one thing that is used world over to treat this cancer. This robotic surgery, when it is done, we remove the uterus, ovaries, tubes and the lymph glands. This much of treatment is essential for all endometrial cancers. Simple doing hysterectomy or uterus removal and ovaries removal may not be adequate in all cases. So once a diagnosis of uterine cancer happens, please consult a doctor who specializes in cancer surgery. So like Gynaec cancer surgeon or Gynaec oncosurgeon who will tackle these cancers, do some molecular testing on them, because molecular testing on these tumors will tell us to know how these tumors are going to behave in future and give treatment accordingly as per the molecular classification. So this is what the endometrial cancers are. Endometrial cancers are early tumors which occur majority of them in early stages. They are treated with surgery and they need molecular testing to know how a woman is going to do in future. Generally, these women will do well if they are in early stage of cancers. In late stages, the treatments differ a bit. In late stages, we give them chemotherapy followed by surgery and followed by radiation. So majority of the centers follow different protocols for these tumors treatments, but on an average, this is what is the treatment. Advanced cases will get chemotherapy, radiotherapy and surgery. All the three are needed. For early cancers, surgery will be enough in majority of the cases. Sometimes you may need radiation to be added to these cancers. Thank you.